Dieses Video präsentiert Ihnen Eumedix.
Hello, my name is Marjorie Taff. I'm a registered respiratory therapist and product specialist for SouthMedic. Today, I am introducing and demonstrating how to use the OxyMask ETCO2 family of products. OxyMask ETCO2 is a revolutionary open mask system capable of providing CO2 tracings while delivering a broad range of oxygen therapy. The standard size OxyMask ETCO2 delivers 24 to 65% oxygen therapy simply by adjusting the flow rate from 1 to 15 liters per minute. Traditional end-tidal CO2 masks are commonly used on non-intubated patients to monitor their expired CO2 during procedures such as conscious sedation, bronchoscopy, endoscopy, and more. Here is how the OxyMask ETCO2 works.
At the heart of this visionary technology is an innovative pin-end diffuser system designed to concentrate and redirect the flow of oxygen and facilitate the monitoring of expired CO2. Let's take a closer look at how this system works. For O2 delivery, oxygen enters the system through a right-angled swivel at the front of the mask. The mushroom-shaped pin redirects the flow of oxygen, forming an organized pattern of vortices and a cloud of concentrated oxygen molecules. The triangular directional diffuser refines the shape of the oxygen vortices and directs the flow towards the patient's nose and mouth. During the patient's inhalation, oxygen flow is mixed with room air drawn in through the mask openings. Respiratory mechanics and breathing patterns determine how room air combines with the delivered oxygen. The concentration of oxygen received during the breath is a function of the oxygen flow compared to the patient's inspiratory flow and tidal volume. During exhalation, although the mask openings allow expired carbon dioxide to escape, the mushroom-shaped pin that is linked to an end-tidal CO2 sample line allows for expired carbon dioxide to be monitored. The sample line can be attached to a side-stream ETCO2 monitor to obtain tracings. With its broad range of FiO2 oxygen concentrations from 24 to 65%, at flows ranging from 1 to 15 liters per minute, and the ability to facilitate the monitoring of expired CO2, the OxyMask ETCO2's open technology replaces traditional end-tidal CO2 interfaces. The large openings in the OxyMask ETCO2 has several intrinsic benefits. These openings allow for suctioning, comfortable nasogastric tube placement, reduces the risk of rebreathing expired CO2 and the risk of aspiration of emesis, while facilitating the monitoring of expired CO2 and maintaining continuous oxygen therapy. The benefits to the patient include reduced feelings of claustrophobia, increased communication, and improved oral and nasal access, all of which improve patient comfort. Clinician benefits include simplified workflows by replacing time-consuming and error-prone device exchanges with a single, easy-to-adjust mask. With its broad oxygen delivery range, OxyMask ETCO2 allows for greater operational efficiencies. Hospitals have less to purchase, less to stock, and less inventory to manage. OxyMask ETCO2 also reduces medical waste and disposal cost. OxyMask ETCO2 is not made with natural rubber latex or phthalates such as DEHP.
Now let's look at the OxyMask ETCO2 family of products. This is a standard OxyMask entitled CO2. It fits the average sized face, or approximately 80% of the patient population. Note, the sample line is available in several different lengths and lure connection options. Here we have the OxyMask entitled CO2 Plus. These masks are 25% larger than the standard masks and are used for patients with a larger face and/or beard. The OxyMask ETCO2 Plus may also be used on the patient whose mouth remains wide open while breathing. For pediatric patients, this is the OxyMask End-Tidal CO2 Kit. These masks are for children 3 to 10 years old and within the weight range of 33 to 70 pounds or 15 to 32 kilograms. The OxyArm ETCO2 effectively facilitates monitoring expired CO2 while delivering oxygen and is ideal for facial trauma and burns, as there is minimal contact with the face. When using the OxyMask End-Tidal CO2, proper positioning and fit is important. An appropriately sized OxyMask End-Tidal CO2 will fit below the eyes and cup the chin. Remove the OxyMask End-Tidal CO2 from the packaging, recycle or discard the insert inside the mask. Gently rotate the elbow to release. Attach the universal connector at the end of the mask tubing to an oxygen source. Attach the ETCO2 sample line to a side stream CO2 monitor to obtain tracings. Place the mask on the patient's face with a swivel and diffuser pin assembly centered below the nose and above the upper lip. Position the elastic strap below the patient's ears or at the crown of the head, maintaining comfortable tension. Avoid pressure on the ears. Adjust the oxygen flow from 1 to 15 liters per minute to achieve the prescribed patient oxygen saturation or oxygen flow rate. The tubing on the mask can be adjusted at the swivel to relieve any twisting or torque. Allow the patient to stabilize and assess. If necessary, reposition the mask, adjust the oxygen flow rate to achieve or maintain the prescribed oxygen saturation. Remember, a properly fitted and positioned mask will obtain the best end-tidal CO2 waveform. A yellow endotracheal tube adapter is available upon request and can easily be attached to the OxyMask ETCO2. This adapter attaches directly to the connector of the endotracheal tube or laryngeal mask to provide oxygen to the spontaneously breathing, intubated patient while monitoring their expired CO2. Once the patient is extubated, remove the yellow adapter and place the OxyMask ETCO2 directly on the patient's face to deliver oxygen therapy in the usual manner and continue to monitor expired CO2. As with all patients receiving oxygen therapy, please contact the physician or respiratory therapist for any acute patient change or as per your organizational policies. An FiO2 flowchart is attached to each tubing. Flow rates with the corresponding FiO2 range are indicated. This provides a quick, easily accessible reference guide for the physician. OxyMask End-Tidal CO2 is the one mask for patient safety, patient comfort, oxygen therapy compliance, and end-tidal CO2 monitoring. One mask, OxyMask. To complete a short online test and for more product information, please visit us at thebetteroxygenmask.com.
Dieses Video präsentierte Ihnen OxyMask.